I appreciate the opportunity to be able to present to you navigation sciences. And one of the things that has really fallen behind in early stage cancer detection is lung cancer. We're at least maybe 25, 30 years behind breast cancer and prostate cancer for the early diagnosis. However, through low-dose CT screening, it has been proven through clinical studies now of over 53,000 patients that you can identify these lesions early enough, you could actually reduce mortality by 20%. Standard therapy right now is a radical surgery, lobectomy or segmentectomy. But the whole idea is to be able to take these procedures and be able to do a targeted, navigated wedge resection. And that's exactly what we're working on. What we're trying to do is make the procedure actually minimally invasive with laparoscopic instrumentation, which they are doing now. But it's very, very difficult to be able to identify these lesions and actually find out where they are in the surgical procedure itself. So what we do is we map out the location through 3D imaging from the CT scans, and then actually place an active fiducial marker, an electromagnetic sensor, in close to where the lesion is. And that's targeted in the delivery interoperatively to actually place this marker in. And then using electromagnetic sensors on the stapling devices, we're actually able to map out in real time the distance between the actual lesion and the cutting instruments, so that we can provide the surgeon information to actually do a full resection, but also a limited resection, preserving as much tissue as can possibly be to allow these patients to be able to keep as much of their healthy tissue or lung tissue as they possibly can. These are patients that are typically long-term smokers that are already compromised. We've done a lot in the development of our company so far. Initially founded at the Brigham and Women's Hospital, the technology that we licensed from, and they had already done at least 100 patients clinically with a non-active fiducial marker prior to our actually licensing it. We've put the team together and funded close to about $2 million at this point in our Series A round. Recently, we have good news in that we achieved our IDE from the FDA to start a 25-patient clinical study this fall at the Brigham with the electromagnetic sensors that we've developed over the last 2 years. So these are very, very exciting times for our company. We have, at this point now, enough capital to take us through the clinical study. We'll be raising a $4 million round in the second quarter of 2021 to complete the development program and then do our 510K application, likely sometime mid-2022 for actual then product release. We do see a significant opportunity for our exit strategy, both minimally invasive surgical companies, robotic companies, as well as the imaging companies like Siemens Healthineers. Siemens has sponsored the clinical studies at the Brigham so far. We've had a significant amount of help from both robotic companies and the minimally invasive companies providing instrumentation to us to help in our development of this device. So our team are my co-founders, both at the Brigham, the chairman of the thoracic surgery division, as well as the radiology department, where the original development work and the IP came from on the program.